today's busy office, one can easily suffer from information overload. That's why Pro EMR gives you everything that you need just when you need it. Here I'm at the clinical dashboard. I've logged in as Jane Lane. I can see everything at a quick glance today. A summary of my inbox messages, including labs that have come in electronically that I can approve online, messages from my staff, to-do items. Down here I can see the patients that are coming in to see us today, the reason they're coming in, and I have a nice continuously changing status. As patients walk into the waiting room, front desk has checked them in. I can see that clearly. I know what room number they're being taken to. Or if my MA is currently with a patient, I can quickly see that as well. Notice that as I complete my visits, it'll say complete. And if I think maybe I might have left something from yesterday or a little earlier today, I can't remember what it was that I still had open, my Open Encounter tab lets me quickly see all my work in process. And I can go back to any of these patients just simply by clicking on them, finish what I was doing, and when I sign off their chart, they'll be removed from this Open Encounter list. Of course, anything that's in this list is not getting billed, so it's in my best interest to get it as short as possible. Other items of interest on this screen, you'll see I have a nice ARA dashboard. This will let me see how are we doing in terms of our meaningful use, and are we meeting those requirements. We can see here we're about 25% of the way, and I'll have a similar dashboard for when I'm working on individual patients as well. If I'm ready to start working on my next patient, we'll say John Shotwell, currently with the MA, coming in for a well child visit, room 15. I just simply click on the patient's name. It takes me right into a nice clinical face sheet. I can see everything that's been going on with this patient at a quick glance. Anything in yellow means it was there prior to today. Anything that we change today, you'll start to see a color change. If I need to come into any of these areas in more detail, I can click on any of the windows. I can also quickly see, based on the color change, whether an immunization is due or whether one has been done. The green indicates ones that have been done, the red ones that have not been done. I can come in here to my vaccination window, and I can let my nurse know that we need to administer some shots. So it shows me the ones that we have, and we can decide that we're going to administer these today. My nurse can come in here later and can just click on the administer button to get those administered. If I click on the vitals on the left hand side, you'll see I can see that my MA has already taken the vital signs for today. And if I would like to take a quick look at the patient's growth chart, then I can instantly view that plotted on the growth chart, and I can pull up the appropriate chart that would show the plotted information. If there's any past data that needs to be entered for this patient, I can always click on my Enter Data. This would be for visits the patient had made to other practices. As I come back to my vital screen, perhaps I'm ready to move on to my HPI. You'll see I have a green arrow at the bottom, and simply just clicking on that arrow takes me to the history of present illness, where it pops up a list of the most common reasons patients come to see you, and I can see to the left the reason why the appointment was made. So we'll say it's a 15-month well child visit. Patient's also having ear pain, so we can choose as many different complaints as we need to. And you'll see the system gives us a nice set of questions. So for my 15-month visit, I can either come down each of these one at a time if I want to, or I could check everything very quickly with the defaults and then just make whatever changes that I need to. So as we click these items, we can also choose for the earache. On the left-hand side, as I click on earache, then I can see the questions relating to that. And I can check these off nice and quickly, specify, is it getting better, is it getting worse, was there any particular context? So we can very easily indicate what those items are. There's always places to put your notes to the right, but you also have these binoculars that let you jump into your favorite phrases nice and easily. So I can come in here and pop those notes in there. If I'm done with this, then you'll see I have a green arrow. It just simply takes me to the next logical step. And here, if I was going to do a review of systems, I can very quickly check everything, or I can come down one at a time through these. And again, perhaps the patient has a fever, and we can be more specific about that. So perhaps it was 102 2 days ago. By the way, you can add your own phrases at any point and all of the phrases in the little binoculars to the right will be different for each of the questions. If I'm done with the review of systems, I see a green arrow at the bottom right, points me on to a physical exam. As I come in here to my physical, I can very quickly check these items off with the defaults if necessary, but perhaps we notice something with the ears, and we can mark these items as necessary. And of course also again put in any important comments as we need to. If there's a need to annotate anything during your physical exam, you can always jump into a nice library of diagrams, pull up the appropriate diagram, and you also have your customized icons. Very quickly I can indicate if I see a rash on the baby's back, on the shoulder, and of course I can put in any notes that I might want to that is giving me more interesting information about that. Everything that you're doing is all going towards creating your progress note, so at any point you can view your progress note that's been created, and we'll see nicely created sentences and documentation based on everything that has happened today. Notice any of the positives show clearly in red, and I can also have my diagrams be there as well. As we come in to do our assessment, we can see that the system can help us to choose likely ICD codes based on whatever the patient's complaint was, but we can also jump into our preferreds, or we can jump into the entire ICD-9 database if we need to look for something else. Notice that I can also do nice separate assessment plans for each of these depending on which is highlighted as I fill in the boxes to the right. So I can use my binoculars here that might have my preferred phrases. So for the earache, I can say, otitis media with effusion. And for my plan, I can also use my binoculars, or I can simply type or handwrite. And perhaps under earache, I might have my specific items that I would like to choose for that as well. And as I choose the care of the healthy child, notice that both of these blank out. And I can come into my specific items there that I might want to work with. So the system very, very customizable. You can always easily add your own phrases just by clicking on the plus sign, but just allows very, very quick documentation. You can also indicate for your front desk, this patient should come back and see us again in 1 week. The reason why, maybe we want to review some labs. Down here, I have these nice buttons as a part of my plan, as well as a part of my ordering, where I can get a lab ordered, a prescription started, a radiology, a consult. So you could really come in and very easily get these items ordered if you need to. And this will go onto a nice order sheet. Your nurse can finalize it, or you could also simply finish the ordering yourself. E-prescribing is also built into the system, so if I want to come into my prescription area, you'll see here the Ciprodex that I indicated I was interested in giving the patient. It pops up right up here with the default strength, the number of days that I typically like to give it, but if I needed to change a different strength or change the frequency, I could do that. I also have a dosage calculator for my pediatric patients so that I can very quickly decide what's the appropriate dose based on their weight and age. From here I can pull up also any educational items, whether it be regarding the drugs or whether it's items regarding the patient's ailments, and I can print this off for the parent as well. Notice the system knows everything about the patient's preferred pharmacy. I can choose any pharmacy across the US, and I can send it directly to that pharmacy just simply by hitting my Earache button in the upper right, or I can also print it out using my print button. The system will alert me if I'm trying to give the patient something that they're allergic to, if there is a interaction with a medication they're already taking, or perhaps a conflict with a disease or ailment that they already have. As we come to the close of our encounter, we might like to know, well, what can we bill for? Notice that as I come into my E&M calculator, the system pulls up all of the codes that are appropriate for this type of visit, and it's also been keeping a tally of the bullets under the HPI, the review of systems, and the physical. It's just up to me to make a subjective decision. Was this minimal, straightforward, low complexity, moderate complexity? And based on this, the system will tell me what I can code for and what I'm missing to get to the next level. So I'm highlighted with the suggested code, which I can either choose, I could override, I could go back and answer the appropriate questions, or perhaps I ended up spending more time with the patient. I can use my time factor, which will be clearly noted in my progress note. Now I'm getting ready to finish, so I'm going to go to my encounter close. Gives me a nice summary of what we've done. We can see we've got our follow-up in 1 week to review labs. And I can just simply say, okay, I'm ready to close, mark the encounter complete. It'll give me a list of some items that I usually like to make sure I do, but I have not done, so those alerts can be programmed. I can still continue. And also if there's anything missing in the meaningful use, it'll let me know any areas for this individual patient. And I can go back and correct those. Or otherwise, if I'm complete, I can come back to my home page and I can see that we have completed John Shotwell. John Shotwell's charges have now gone over to the PM side, where my biller can quickly get those submitted as a claim.